Welcome and thank you for your participation in Sarasota Memorial Orthopedic's Discharge education. A few things to accomplish before you leave the hospital. First, a doctor's discharge order must be entered into the computer. Physical therapy will also work with you to prepare you for going home. In order to be safe, your surgeon wants to see you able to get out of bed, attend to your toileting needs, take a small walk, and get yourself back to bed with minimal supervision or assistance. Another step involves case management, arranging a home health company to visit you at your house. A caseworker will typically stop by the day of or the day after surgery to obtain your request for which home health company to use. Home health typically consists of a nurse and a physical therapist that will come and visit you at your home. A hospital caseworker will also order any necessary medical equipment you need to go home with. In most cases, the equipment will be delivered to your room in the hospital before you leave. Do a final scan of the room to make sure all your belongings are gathered and make sure nothing is left behind. One of the last steps to leaving is decide if you would like Walgreens to fill your prescriptions. Walgreens offers a bedside delivery service, so your prescriptions are delivered to your hospital room before you leave. There is no charge for the service itself. Your normal copay through Walgreens will be the only payment required. Prescriptions typically consist of a pain medication and a blood thinning medication. After you go home, you will be contacted by your home health company. Home health visits will start the day after discharge. The company will call you in advance to inform you the names of the nurse and the physical therapist that will be out to work with you. If you have not heard from your home health company by the afternoon the day after discharge, please call them to touch base with them about your schedule. The nurse will come out to see you approximately 1 to 3 times per week. You will not need to do any incision care until instructed by the home health nurse. Please do not touch the incision or put any kind of ointments or creams on the incision until the surgeon has okayed you to do so. The nurse will manage your incision care, remove the staples when ordered, review your medications, and assist with any other questions or concerns you might have. The physical therapist will see you typically 2 to 3 times per week, occasionally more based on the type of surgery and your needs. The therapist will address mobility around your home and will also develop a plan of care and activities to maintain on the days they will not be by. Please be sure to follow instructions given to you by your therapist to keep you safe and assist in your recovery. Take pain medication 30 minutes to 1 hour before therapy to have the most effective session. Your activity at home is a very important part of your recovery. Take your time when moving. Safety is always the #1 priority. Make sure you use your walker every time you are up until you are cleared safe by your physical therapist to not use the walker. Follow all precautions set for you by your surgeon. Your physical therapist may clarify any questions you have regarding precautions. Small, frequent walks around your house will help you with circulation and stiffness. Be sure to rest in between these walks. When you are resting, it is helpful to elevate your extremity to assist with swelling. Rest is just as important as activity. Driving is not allowed until cleared by the surgeon. Once the surgeon has cleared you to drive, start off slow. A small drive around the block is a good way to feel comfortable again. Once you are cleared to shower, please use caution. A shower chair may be helpful. Your home health nurse will have instructions from your doctor on when it is okay and what steps need to be taken to shower. Avoid baths, hot tubs, swimming, or other situations your incision may be submerged by water until your surgeon has cleared these activities safe. It is normal to need to use your pain medication after you go home. Talk to your nurse in the hospital about how often you have taken the pain medication while hospitalized. This will give you a good idea of a routine to continue with at home. Talk to your doctor or home health nurse about weaning down when needed. The most common time to need pain medication is before your physical therapy and before bed. Nighttime can tend to be a little more sore and achy. Writing down the pain medication will help you to remember when your last dose was taken. Continuing to use ice at home is also important to help with pain control. Try to use ice at least 20 minutes, 2 to 3 times per day. You can also use the rule, 20 minutes on, 20 minutes off. Use a barrier such as a towel or pillowcase between your extremity and the ice. Never put ice directly on your skin. Ice will help with your swelling, which in return will also help with your pain. If your pain medication contains Tylenol, it is recommended not to exceed 3,000 milligrams of Tylenol per day. Tylenol is also known as acetaminophen. On your prescription bottle, it would be the second number, typically 325 milligrams per pill. Percocet and Norco are the common Tylenol-containing medications. Avoiding alcohol is also recommended while taking pain medication. Alcohol will increase your fall risk and also cause additional stress on your liver. Avoid taking any medications that also increase drowsiness, as this is one more risk factor for falling. If you are having difficulty tolerating your pain medications, contact your surgeon. Also avoid taking NSAIDs until your surgeon has cleared you to do so. Common types of NSAIDs are ibuprofen, naproxen, Aleve, Motrin, and Advil. Blood-thinning medications are typically continued 2 to 6 weeks after surgery. This is when the chances of developing blood clots in your legs are the highest. Some of the common blood thinners are Lovenox, Eliquis, aspirin, and Coumadin. One thing to watch out for is your blood becoming too thin. This is an uncommon side effect, but things to look for are excessive bruising, bruises that continue to grow or worsen, nosebleeds, bleeding gums, pink-tinged urine, or black tarry stools. If you experience any of these things, contact your surgeon. You will be given a list of medications to continue at discharge. Not all home medications are resumed immediately after surgery. Commonly held medications are multivitamins, supplements, fish oil, and certain RA medications. In the hospital, you will take Colace as a stool softener twice a day. It is recommended to continue this at home to try to lessen constipation. Laxatives or suppositories are commonly needed for constipation after surgery. Contact your doctor if you have any uncomfortable side effects or reactions to the medications you have been given. When you go home, it is common to have a poor appetite after surgery. This can be caused from various medications, constipation, and lack of mobility. It is important to maintain the best nutrition to assist with healing. Hydration is very important after surgery. It is recommended to drink at least 8 cups of water per day. This will help to prevent constipation and detox the anesthesia out of your system. Protein in your diet will help with the muscles and help with the wound healing. Foods such as lean meats, fish, tofu, cheese, and nuts are good sources of protein. Also, adding fiber into your diet will help to minimize constipation. Dried fruits, whole grains, berries, and oatmeal are good sources of fiber. Some additional information to keep in mind when you go home. When you pick out a chair to sit, you might want to pick something similar to a dining room chair. Something that will provide a solid surface to push up from will make it easier to get up and down. Some patients may also find a raised toilet seat or a commode that sits above your toilet and provides handles to push up from is helpful in the beginning. Your hospital therapist can provide a recommendation on whether or not a commode is needed. The ankle pump exercise is also recommended to continue at home. These are performed by pointing your toes down like you're hitting a gas pedal, then bending your ankle up so your toes are pointing to your nose. These motions help with the circulation in your calves. The last recommendation is to continue the use of your IS or your incentive spirometer at home. This breathing exercise brings oxygen into your lungs, prevents development of pneumonia, and assists to keep your temperature down. The exercise is done by inhaling into the mouthpiece like you are drinking through a straw. Breathe in slow and steady, as deep as you can go, so the large round disc rises up. Repeat this step to total 10 breaths per hour while you are awake. Unexpected complications to be aware of after joint surgery are a DVT or a blood clot in your leg. Signs to look for are swelling in the calf, pain or tenderness in your calf, redness or warmth in your leg. Call your home health nurse or doctor if you are experiencing any signs of a DVT. A pulmonary embolism, or PE, is a rare but serious complication where the blood clot may travel into your lungs. Call 911 immediately if you have any symptoms of a PE. Symptoms include sudden chest pain, shortness of breath, increased heart rate while resting, or confusion. Again, call 911 if you have any symptoms of a PE. Other complications to be aware of are pneumonia and infection. The use of your incentive spirometer will help to reduce your risk of pneumonia. Signs of pneumonia include coughing, chest pain, fever, and increased fatigue. A sign of infection includes redness or warmth surrounding your incision, a fever over 101, increased drainage, odor coming from the incision, and increasing pain in your leg. Contact your home health nurse or your doctor if you have any signs or symptoms of pneumonia or infection. Call your surgeon or your home health nurse if you experience any of the following symptoms. If your pain is no longer being controlled by your pain medication, even after resting in elevation, if you develop increased swelling or drainage coming out of your wound, if there is new tenderness in the thigh or calf, if you develop a fever over 101, or if you are bleeding and bruising very easily. You can contact a caregiver through your home health agency, your surgeon's office, or the hospital at all times, even out of normal business hours, for any of these symptoms mentioned. If you fall at home, even if you don't feel you're hurt, please contact your surgeon's office to clarify if any additional follow-up may be needed. Please call 911 and seek immediate medical care if any of the following occur: difficulty breathing, shortness of breath, new dizziness or loss of balance, unable to speak clearly, facial drooping, difficulty lifting arms, any new numbness or tingling, or you feel your heart racing without an increase in activity. These symptoms can represent a rare but serious issue. If you have any additional questions regarding your discharge education, please call Lisa Kennedy, Orthopedic Program Coordinator at Sarasota Memorial Hospital at 941-917-7963. You can also reach us 24/7 at Sarasota Memorial Orthopedic Floor at 941-917-5529. Thank you for choosing us for all your orthopedic care. We appreciate your business and look forward to seeing your recovery.